Tonight, you will run your tongue over your teeth before you fall asleep. You will not think about it. It is automatic, invisible, unremarkable. But somewhere on a bathroom counter or a bedside table, there is a bill that says otherwise. A crown, a filling, a cleaning that costs more than your monthly grocery run. You assume the price reflects the work, but the real answer is far stranger. Your teeth are the only part of your skeleton you can see while you are still alive. Think about that for a second. Every other bone is hidden, wrapped in muscle and skin, safe from your gaze and everyone else's. Teeth are different. They are bone on display. And for as long as humans have been forming social groups, visible bone has meant something. It has meant health. It has meant youth. It has meant fitness to mate, to hunt, to survive the next winter. Your brain still runs on that old code, even though you have never hunted anything harder than a parking spot. This is where the story of modern dentistry actually begins. Not with drills, not with insurance forms, with a signal your ancestors could not fake. Anthropologists studying wear patterns on ancient molars, including work associated with paleoanthropologist John Lukács, have shown that tooth condition was one of the clearest markers of overall health available in prehistoric populations. Weak enamel, abscesses, early tooth loss. These were not cosmetic problems. They were survival problems. A mouth full of infection could kill you long before modern medicine existed to explain why. So evolution wired you to notice teeth. Yours. Everyone else's. It is not vanity. It is an ancient health scanner still running in the background of every smile you exchange. Now fast forward past agriculture, past sugar, past the Industrial Revolution, into a modern dental office with fluorescent lighting and a reclining chair. The scanner in your brain is still active, and someone figured out how to profit from it. Here is the part that surprises people. A dentist's income has very little to do with how much pain you are in. It has almost everything to do with how much uncertainty you are in. You sit in that chair, mouth open, unable to speak, staring at a ceiling tile while a stranger in a mask examines a part of your body you cannot see for yourself. You have no mirror, no second opinion in real time, no way to verify anything they tell you. This is what economists call an information asymmetry, and it is one of the most reliable profit engines in medicine. Health economist Uwe Reinhardt spent decades studying this exact imbalance, showing that when a patient cannot evaluate the necessity of a treatment, the provider effectively decides both the diagnosis and the price. In most industries, that would be considered a conflict of interest. In dentistry, it is simply Tuesday. This does not mean every dentist is dishonest. Most are not. But the system itself is built on a gap between what you know and what they know. And that gap is where the money lives. Consider the words themselves. You are told you have a cavity that needs a filling. You are told a crack requires a crown. You are told your wisdom teeth should come out before they cause problems. Notice how rarely you are shown the actual X-ray and walked through the decision as a genuine choice. Notice how often the recommendation arrives already finalized, waiting only for your signature. Why does this work on you so easily? Because of a second, older piece of psychology layered on top of the first. Trust in authority figures wearing symbols of expertise. In a well-known study on obedience to perceived authority, researchers dressed test subjects differently to observe how compliance changed with the appearance of status. The specific finding that echoes loudest in a dental chair comes from research on the so-called white coat effect, widely referenced in medical psychology, which shows that patients rate the same advice as significantly more credible when delivered by someone in clinical attire inside a clinical setting. A mask, gloves, a framed diploma on the wall. None of it proves competence. All of it multiplies compliance. So now you have two ancient systems stacked on top of each other. Your brain telling you teeth equal health equals danger. And your brain telling you an authority figure in a coat must know best. Combine them, and you have a nearly perfect environment for upselling. This is not conspiracy. It is business model. Dental offices, like most small medical practices, operate on thin margins after rent, equipment, staff, and insurance overhead. A single dental chair with its imaging equipment can cost more than a car. Hygienists, assistants, and front desk staff all need salaries whether or not a single patient walks through the door that day. So the practice needs consistent revenue, and the most reliable revenue does not come from emergencies. It comes from routine visits that quietly expand in scope. A cleaning becomes a cleaning plus X-rays. X-rays reveal a watch area. The watch area becomes a filling next visit. The filling, years later, becomes a crown. Each step feels small. Each step feels reasonable in isolation. But zoom out, and you can see a slow, steady staircase, and you are the one climbing it. Insurance makes this staircase even easier to climb. Dental insurance, unlike medical insurance, usually caps out at a low annual maximum, often between $1,000 and $2,000. That number has barely moved in decades, even as costs have risen. Which means once you hit your cap, the incentive structure flips. Practices are financially motivated to schedule the more expensive procedures before your benefit year resets, and patients, fearing they will lose unused coverage, often agree without asking whether the timing was clinical or financial. Here is a question worth sitting with. If your dentist recommends a treatment today that could just as easily wait 6 months, and that treatment happens to fall right before your insurance resets, was the timing about your teeth or about the calendar? Most patients never ask, not because they are careless, but because the entire environment is built to discourage questions. The chair reclines you into a vulnerable, half-lying position. The tools in your mouth make speech physically difficult. The professional standing over you holds both the information and the instrument. Every incentive in the room points toward silence and agreement. And yet, here is the twist that reframes everything you just heard. This is not evidence that dentistry is a scam. It is evidence that dentistry, like almost every profession built on expert trust, runs on the same evolutionary hardware your ancestors used to decide who to trust around a fire 40,000 years ago. You are not weak for trusting a person in a white coat. You are running exactly the software you were built with. The problem was never your instincts. It is that modern institutions have learned, consciously or not, exactly which instincts to lean on. Once you see the pattern, you cannot unsee it. The second opinion you almost never ask for. The itemized breakdown you almost never request. The simple sentence, "Can you show me on the X-ray?" that instantly shifts the power balance back toward you because now the diagnosis has to survive your scrutiny instead of your silence. None of this requires distrust of every dentist you will ever meet. It requires something smaller and more useful, curiosity in the chair instead of compliance, a question instead of a nod. Tonight, you will run your tongue over your teeth before you fall asleep. You still will not think about the code running underneath that habit, but somewhere in that reflex is the same ancient scanner that once decided who was healthy enough to trust, now quietly deciding who gets to send you the bill.